Welcome to the office.
Thank you for having me.
You're welcome. What brings you here?
Pain in my left side. I slipped and fell.
Hold on. So right now you're having pain left leg?
Yes, like sciatica, the tingling and the numbness every now and then, mostly the tingling.
What happened?
I was taking my son to work and I was holding my niece on my hip and I was going around the car to put her in her car seat.
Okay.
And my driveway is an incline, so I slid.
Okay.
And when I slid on this whole side.
And you hit your left side?
Yes.
Okay, ma'am.
Still holding my niece because I didn't want her to get hurt.
Okay, so you saved her.
Yes.
You landed on your side here.
I landed on this hip.
Did you get any bruising?
No bruising.
Okay, what happened immediately?
I was telling my son, he was asking me if I was okay. I said, no, I'm not okay. Get the baby. And then when I stood up, I was just wet. I was fine, you know.
Dealt with it? Did you take anything? Did you
No,
ice, aspirin, Advil, any of that?
Nothing.
Okay.
No pain, no nothing.
Okay.
Just went on.
Okay.
Then on January the 12th, my birthday
Okay.
of 2020, my niece, I picked her up and she slinged back to have a tantrum and I heard a pop. I couldn't come back straight.
Same spot?
Yes, it's like right in the tailbone, not the tailbone, but it's this right in there.
Hey, she's telling me she got a pain in her butt.
Yes.
That's what you're telling
Yeah,
me.
it was deep down, like right deep down.
In the glute.
Yes.
Do you feel it when you sit more,
Yes,
stand,
I
or
find
walk?
myself all the time.
All constant.
Constant.
Is it waking you up in the middle of the night?
Yes.
How many times?
All the time. In order for me to move, I find myself waking up to move.
Okay, and now you're antalgic. You're compensating to the opposite side.
Exactly.
Okay, you saw anyone for this, I'm assuming?
No.
You didn't go to the doctor initially?
I didn't go to the doctor.
Why is that?
Because then we went in lockdown.
Okay.
I thought maybe 6 weeks I'll feel better, you know. And then,
Maybe it'll go away.
Yes.
That's the magic answer.
It'll go away, you know.
Okay.
And it didn't.
And you're just dealing with this.
Yeah.
Okay, and so how is this affecting quality of life now? You
It's
have
horrible.
low back pain, shooting down the left leg,
Yes.
any irregular bowel movements, you're going to the bathroom okay?
You know what? Okay, my doctor did prescribe me.
So you did see somebody?
Not for the pain. I
Okay,
talked.
okay.
And I said my sciatica is bothering me because it's the nerves. It's just tingling all the time.
Right.
So they gave me a muscle relaxer and
Okay.
ibuprofen.
Okay.
I stopped taking it about 2 or 3 months later because I was having heartburns, dry mouth, and being constipated.
So what do you do now?
Nothing. I just
Ice?
I do use ice, or I will take a bath in Epsom salt, but mostly ice.
Who taught you that?
No one.
You just figured that out?
Well,
Because that's what I'd be recommending.
Oh, okay.
That's what I thought. Maybe you heard it. This is good. We normally recommend a full cup,
I do.
20-minute soak.
Yeah.
And how did you get here, ma'am?
My son drove me.
Okay, I was about to say, it's a little bit of a drive,
Yes.
and you're okay with the drive.
Yeah, I just turned sideways like this.
Okay.
Well,
Well,
and I have heated seats, and that feels real good.
okay, well, from today, there's no heated seats and there's no heat.
Okay.
And I'll explain the process.
Okay.
Okay, please. I'd like to see you walk first. And if you need, you brought the cane, you brought a walking stick?
Yeah, I can do without it.
Okay, so we
Just don't
can,
walk far.
why don't you keep it next to you?
Okay.
And the only reason why is if you need it, you can walk with it once or twice. How did you find us?
On YouTube,
Okay. How long you been following?
since I hurt myself.
Okay, fair enough. You just started looking for solutions?
Yes, what to do for sciatica, because I've been doing some stretching.
Okay.
First I was doing yoga. I said, oh, I can't do that. So I just did stretching.
Okay. I want to explain sciatica because sciatica historically is really a symptom. And it became a diagnosis, right? And the way it happened is this. Sciatica means I have some sort of dysfunction going down the sciatic nerve. The sciatic nerve, and I want to show on this map over here, or this chart, this is the sciatic nerve. And the sciatic nerve originates from the lumbar and the sacrum, and it forms this big nerve that goes down, and it powers and gives all the information for the lower extremities and also the lower organs as well. here's the thing, and I was this case. That's why I'm sharing this with you. And I don't know your answer yet till we get started. But I do want to share, this is very important information. When you say sciatica, it doesn't really tell us anything. But typically when you're out there, you say, oh, I have numbness or shooting pain. Ah, it's sciatica.
Exactly.
But what caused it and what's the solution? I was the patient many, many years ago. Okay, I was a patient first, 10 car accidents. I know back pain. Okay, I had a bad L5 disc. It took a long time to get healed up. However, I had an incident episode about 9 years ago. Okay, and I was bedridden. I couldn't move for about a month and a half. And the people that I had gone to here, they did my L5, my sacrum, my pelvis, my L4. Nothing was working. And I went to one of my mentors up north, northern United States, northwest, and took a new x-ray. He examined me, but he just looked at the film. He says, Rahim, it's not starting in your low back. It was coming from my third cervical. And all he did for 1 week is adjust my third cervical, okay? And I still had pain though. I'm like, doc, it still hurts. Still hurts. He says, Rahim, get your third cervical set fixed, then go to your low back. And that was my case. And what was interesting, I'm sharing it, this is why I'm sharing it. I had 50 cases of sciatica right after, within 3 months. And they were all third or fourth cervical. And the point and the moral of this story is anything can cause anything. Okay? You had a couple of falls. Yes, something happened to your low back, but I'm pretty sure something happened up top too. Okay. And that's why we have to check everything. All right. And that's why I have you take a full spine x-ray.
Yes.
Okay?
Okay.
What else is going on?
That's all.
That's it?
That's it.
All right. Now, we got to watch here the dimples. They need to be moving up and down, not side to side, not wiggling and waddling. All right, go ahead and walk towards the nervous system poster, please. So what we're seeing first right now is she's antalgic forward and to the right. That gives you the most relief, correct?
Exactly.
Now, okay, come over here. Keep going, please. I want you to focus on the antalgic, okay? She's forward and to the right. Now in the way back, watch her whole body and then watch her feet. She's very guarded. Okay, yes. Would you like me to hold this now? Okay. She's even more guarded. It's almost like that side wants to collapse, right? Exactly. Are you feeling your right knee trying to give out or your left knee?
It's here.
It's at the hip. Mm-hmm. Okay. And can we do one more maybe?
Yes.
Yeah. You have sprained your ankle at some point, ma'am. You're pronating on both feet, okay? More on your left. There's a pronation. So with that fall, I have a feeling some of the ankle was misaligned as well. I'm checking everything regardless, okay? Now, one last thing I need to do. You're going to walk back and forth one more time. You need the cane for the last one? Okay, perfect. So the right side goes up and down. The left side goes down, but doesn't go up as much. Now stop there, please. You're going to hold my hands here. Face me. March in place, please. Let's do it right here. Come over here. Step to the right a little bit. And let's march in place. Now, just use my hands as you need it. Eyes open, please. Good. Knees up high. Okay. Okay, that's it. That's it. All right. Let's stop there, please. That's enough. You want to go ahead and have a seat? We're going to be going over your x-rays next. Okay. As I'm going through this, and I know you were taking these x-rays, it was very difficult to take. You were antalgic, trying to lean, you were trying to stand up straight, but obviously trying to lean away from the pain. That's why you're tilting to that right side. Okay, let's go over this. This is a picture in time, ma'am. There are 24 bones in the spine, 23 discs in between. 7 bones in the neck called cervicals, 12 in the mid-back called thoracics, 5 in the low back called lumbars. And this is the foundation of this 24-story building. The foundation consists of the sacrum and the pelvis. Right now we have a 17 millimeter leg length discrepancy. It means the left leg is shorter than the right. Now, ma'am, I don't believe that happened from the fall. I think we had that the whole time, and the fall exacerbated something that was there. Okay, and that's okay. But I just want to point that out. Now, ideally in this work, it should be under 7 millimeters for these adjustments to hold. But we don't know with the antalgia and the pain that you're going through. So I'm not going straight to put a heel lift in there. Okay, and we have to figure out if you're actually even indicated for it, or is there an answer somewhere else. Okay? All right, so we have a PI3, IN10, measured difference of 17. With correction of this pelvis, 7 times 4 is 2.8. It's actually going to get worse if I correct your pelvis. And it gives us an answer, that the answer of correction is not in the pelvis. Okay, so this is going to be 19.8. Okay. All right, so let's talk about how this thing is misaligned. This is our pelvis, right? This is your hips. And they work in opposite. One side goes up, the other side goes down. One side goes in, the other side goes out. So the sacrum on the right side has rotated to the right. But it's dropped on the left 8 millimeters. Now follow me, please. This is the left pelvis, this is the sacrum. The sacrum on the right side has gone back, but it's tilting on the left. The ilium, or the hip on the left, has gone down and in. So your whole pelvis, your foundation, wants to go to the left side. And then it's dropping on that side, and what are you trying to do? You're trying to go the other way. That's the disconnect in the foundation. Now, you're telling me sciatica, you're telling me shooting pains down the leg, right? To the big toe. Big toe nerve distribution is L4, fourth lumbar. That's around here. What I'm seeing here is this. We'll deal with this, but we have a little bit of calcification in this area between L3 and L4. It tells me there's been instability there for a while. Okay? Activity-wise, are you working? Were you working before all this? You're home?
Yeah, I was working
desk job?
Preschool teacher.
Very cool. Very, very cool. Nice. I used to teach preschool classes too. I used to teach this to preschoolers.
Wow.
I used to actually take full spine x-rays, and they all got it at 5 years old.
Yes, they're very intelligent.
They're very smart. Okay, so this is the foundation. We need to figure out where we're going to start. From there, now, I did 2 things here, because we got to figure this out. If your L5 is supposed to be here, but right now your sacrum is tilted. Now, if I go to the level foundation here, your 5 is the first one to come off level. 4 comes back. Then 3 goes off. And 3 takes your whole spine out all the way to T8. From T8, the next one to go off is your T6. And T6 continues to take your head to the right. And what I'm trying to show you here is this. Your body is compensating, but even in the mid-back compensating, it still wants to go to that right side. Okay? Does that make sense so far? Okay. So along here we have, I'm seeing here, there's calcification, little bits and pieces. Then we get to T8, there's a hook right here. So your body has been going through this for some time. The fall triggered it. I'm just reiterating that for a reason. And the reason why is once we get started, it's gonna be spicy. You heard me talk about it. You're okay with it. It's gonna be a little spicy. Okay. All right. Now from T6, everything goes over to about the neck around C7. From C7, we have a compensation there. Okay, let's go to this x-ray now and explain. This is an older injury, a tailbone injury. So you did have an old tailbone injury way down low, not on this side. Something happened, whatever it was. L5 though, after we deal with this is the culprit. That's L5 disc. And the L5 disc is nice and swollen. Okay? Not a problem, I'm just explaining. So, should be like this. Yours is actually swollen like this.
Better in the mornings.
Yeah. And then as the day goes, it starts to get less And then you start to lean more and
Yes.
more each time, right?
Exactly.
You got it. Last thing I want to talk about is your posture. We do a plumb line. We take a laser lever through L5, run it straight up. It should bisect 7 and 2. Yours is way back here. But again, it's because you're antalgic like this.
Yes.
We'll deal with that part later.
Okay.
Right now, the main thing, get you out of your acute pain.
Okay.
Cool?
Yes.
You ready?
I'm ready.
Starting at the base of the neck, let's see what we find. Well, 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 what do you know? We got pressure at your third cervical. About 5, 6, 8, 9 points. 10 points. Third cervical, left side. That's around T7, T6 area, 10 points. Left side. All right. Now let's see what we find here. 10 points. S3. 10 points. That's down low around S3, around T7, and third cervical. Next thing we're going to do is, let's go ahead. I want to check your hips, okay, ma'am? Can I have you scoot forward to the edge of the table, please? Is it okay to lift yourself up like that? No, do you have pain in your back when you do that?
A little.
A little bit, okay. Now, I'm on the dimples here, ma'am, okay?
Mm-hmm.
I'd like you to keep your feet together. Open and close your knees, please. Open and close. Feet are touching. Good. Open wide, close. Open, close. Right side only, please.
Oh.
It's okay. You okay there?
Uh-huh.
Good. Left side only.
It hurts.
Yes, ma'am. It hurts left or it hurts right?
It hurts right here.
Okay, now here's what's interesting though. Do the right side. When you do the right side, the left hip is okay. When you do the left side, this is coming from your sacrum on the right down low. Scoot back for me, please, ma'am. Okay. I'm going to have to dig a little bit, okay? All right. This is your fifth lumbar. You're okay with that, right? S1. S2. A little tender?
No.
Not too bad? S3. It's hiding on us, man. Huh. 5. 4. 3. Let's check the hip. Left side, please. Turn to the left slowly. That's the top of the joint. That's the middle of the joint. That's the bottom of the joint. Hurts more at the top, ma'am. More there. Or down there.
The top.
Okay. So this is more the left, top of the left SI in terms of what she's feeling. Nerve pressure, though, around your back for me, ma'am. We got to hunt. You're going to make me hunt today. That's all right. Let's statically palpate, running the fingers down the spine. And we can see the pooling edema right there, right in that area. 7, 1, 2, 3, 4, 5, 6, 7, or 6. 7 more tender or 8 more tender? 7 or 6? She's a tough cookie, yo. You taking something right now?
No. I've been off that medicine for like 2 months.
6, 7, 8 or 7? 8 or 9? Let's wait on that. She's not even flinching on that one. Let's go back to the low back. Alrighty. Back towards me, ma'am. Number 5. 5 to the...
It hurts over
There,
here.
there.
Right
So when I did that to the left is when you felt it. Okay, so what's happened is this. Okay, sorry. Let's go down sacrum to the left. Yes, okay. Sorry, ma'am. I have to test one or two more though, okay? All right, so we're gonna go to 5. Okay. So 5 to the left hurt. S1 to the left hurt more or less?
Less.
Okay. S2 to the left.
That hurts too.
Does this one hurt more when I push here or this one here?
That one.
That one. 5. S2 left. No. It is L5. Okay. 1, 2, 3, 4, 5, 6, 7, 8. We're going to check that afterwards. We're going to focus on 5th lumbar, left pelvis. Now let me check your neck, okay? Sit back for me. Center on the chair, please. Awesome. All the way back. We good?
Yes.
All right. So from the front, we want to just look at the range of motion. Turn to the left. That hurts there. Turn to the right. There's more range of motion, rotation to the right than there is to the left. Look up at the ceiling. We're isolating the lower cervical. Up and left. There's more motion, though it's guarded. Turn right. Good. Down and left. That's upper cervical. Down and right. So we're getting 3rd cervical, ma'am. Do you feel this one here?
Yes.
Okay, now if I go to the top here, that's not so bad.
No.
Top at C1, that's not so bad.
No.
Okay. All right, let me look at your x-ray for a second and figure out where we're going to start. Now, here's what I'm doing. Come over to this x-ray. She is antalgic. She does have a short leg. We know there's a discrepancy of the sacrum down. The pelvis and the SI joint, there is fixation. And there's a lot of antalgia, though, and I believe the antalgia has been there for a while. So I really had to go back and to the left to activate or trigger this part of the body, okay? So what we're going to do today is I'm actually going to start on her 3rd cervical up top. Hi!
Hi.
Are you ready?
Yes.
All right. I think you waited long enough, yeah? 2. This is the 3rd cervical. This one's not too spicy, okay?
Okay.
This one's not too spicy. But the key with this is just let that left ear go down, down. Gotcha. Now, what's interesting on that set, you felt that, right?
Yes.
That was a deep set, but it wasn't a big crack.
No.
Now, let's do this. Turn to the left. Turn to the right.
Wow.
Turn to the left again. Different.
Yes.
Very different.
Awesome.
Now, I didn't touch your low back, ma'am. I want you to stand up and walk. And you tell me if anything is different, okay? Good, bad, whatever.
I'm scared to walk.
Don't be scared. No fear, ma'am. Here's your cane. Use your cane then. Go faster with it.
No, I don't need it.
I know you don't, because you're actually a little straighter, ma'am.
Yes. For my neck?
Yes, ma'am. Walk 3-4 times. Check it out. Devin, do you see that? Am I hallucinating? Is this hocus pocus? Magic is an illusion. This is not magic, ma'am.
Wow.
Keep walking, ma'am. I didn't touch your back.
I know.
And I don't know why I shared that story, but you were also that story. So 3rd cervical was part of the issue.
Wow.
What's different as you're walking right now?
I don't favor to the right.
Yes, ma'am. Can you start over here, please?
Still a little bit in the leg.
Yes, ma'am.
Other than that?
Different, though.
Yes.
How is the shooting pain or sciatica down the
I
leg?
feel the pain.
You don't feel it?
No, no tingling.
All right. Come over here. Let's have a seat, please. Next thing I'd like you to do, I'd like you to sit and stand 3 times by yourself. You can push off your knees.
Okay.
I just want to make sure you can do this.
Awesome.
Yeah, just up and down. Keep going. A couple more times.
Oh my goodness. I have not been able to do that in a long time.
And all we've done is third cervical so far.
Oh my goodness.
Okay, that's a good start. Let me rescope now before I continue. Okay? Awesome. Now, when you're sitting, you see, you're sitting straighter. You're not favoring your right butt cheek, right?
Exactly.
All that from a third cervical. So there's a saying, and Gonstead had a saying. Find it, find the subluxation, find the nerve pressure. Accept it where you find it, which means it can come from up here, causing sciatica. It can come from down low, causing headaches and migraines. Accept it, fix it, and then leave it alone. Okay? Let's continue, ma'am. Neck is clear. Awesome. So this has actually been reduced. It's there, but it's shifting now. Left. I'm still going to wait on that. That shifted. Look what happened. Pressure's been reduced half already. 5. Now, let's recheck it, please. Back slowly towards me, ma'am. I'm on L5 again. I know it's tender, but it's not the same. There's no pain. There's nothing shooting down.
Right, exactly.
All right. Stand up and walk. That's pretty cool.
It is.
That's pretty cool.
You're this my hip and this my neck.
It started at your neck.
Wow.
So it's good. You didn't have to do the low back. I do want to do one thing though. I'm going to just start a little bit of that sacrum.
Okay.
And I want to do using the drop board so it doesn't aggravate too much, but I do want it, it's a tiny bit on the left side, just a tiny little bit.
Is it spicy?
This one's not spicy at all. Okay, so we're on the sacrum. Down like this, okay? That's it.
Nice.
That was it, lady. Hold my hand, please. Come off slowly. And go ahead and walk.
Oh my goodness.
What happened?
That is awesome.
What happened?
It's gone.
What's gone?
The pain. My hip.
Hold my hand. Raise that left leg up. Raise it up.
Yes. Wow.
And now she gets to see what we really do here too, right? Now you get to see
That
it.
is so awesome.
All right, ma'am? That's where we're going to start.
Oh, thank
Now,
you so much.
You're welcome. Now, there's one last thing. I do want to start your ankles.
Okay.
Same thing. I'll use the board. Go on your back, please. Put some paper there for you. There you go.
I just
Look.
looked up. I just looked,
Look.
I just looked up. That was awesome.
There you go.
Oh my goodness.
So, ma'am, I didn't expect it either, okay? We figured it out in the exam.
Oh my goodness.
Your hips are good.
Yeah.
Bend your knee.
Oh my goodness. Oh wow.
Good.
Wow.
Straighten your right leg only. Right leg only. AS talus, medial tilt. Bend this knee, right knee. Straighten out the left, please. Straighten it out. Now, let's see you get up nice and easy. Turn to your side, your right side. Yes, ma'am. Stand up, walk it off one more time, then you get your buff and polish. Yes, ma'am. We have at least 50% reduction.
Yes.
Good. Have a seat over here and let's do the buff and polish now. Now, after we're done here, you do need to do some movement.
Oh,
Now,
that is perfect.
Yep.
Exactly what I want to do.
Get some movement. Don't overdo it. I will give you an ice pack. I have some enzymes for inflammation. And if your drive is going to be more than an hour for any reason, please stop and get out for 2 minutes.
Okay.
Okay?
All right.
You got it.
Thank you so much.
Yes,
Oh
ma'am.
my God.
Ba-da, ba-da-da-da-da. 5, 4, 3, 2, 1. Now let's do the ears. Good. Let's do the shoulder. Let me do the work, please. There you go. Shoulder. There you go. Nice. All right, man. Squeeze. You know the deal. Squeeze. Elbow on that side. Squeeze. Squeeze. Let's do the elbow. Posterior ulna. Relax there. There you go. Posterior luni. That's it. Go like that 5 times, please. Squeeze. Solid. Any questions for me?
No, just thank you so much.
You're all set then.
Yes, I
Well-
can stand up straight.
Yes, you can. Welcome to the office.
Thank you.